Hi, all. We are short two members at the moment, and it doesn't look like Jenna's on yet. So we will continue to wait and see if we get quorum. Many are out today from our council for legislature, but we should have quorum. We're too short right now, and one of them is Jenna. There she is. Just as a reminder, if everybody can put their name and affiliation in the chat, that will help with the minutes. And as of right now, I believe the Jenna that joined is our chair. And if so, we are one short of quorum as of right now. Hi, Jenna.
Hi, everyone. Sorry, I'm here. I just was finishing my lunch. Sorry.
Yeah, please do. You're okay. We're still waiting on quorum, so you're good.
Good afternoon. How are you doing today?
Good, Andre. How are you?
I'm doing good. I attempted to type my name inside the chat box, but it's asking me to put the name of a person or group, and when I type anything in, nothing comes, so I'm unable to do that.
Okay. I'll note on my handwritten notes here.
Okay. Thank you.
Of course. And it looks like we have some phone callers that are joining us. If any of the individuals that are joining by phone are members of the council, can you please unmute yourself and let us know? As of right now, we are one short of quorum. And I will, I know I was sharing before for anybody who was on, excuse me for repeating myself. A lot of our members are unable to join today's call, but I had some that I still didn't receive a response from. So we're still waiting to see if we'll have that one additional individual. But many of them had conflicting meetings today. It looks like we have Brittany in the call. Brittany, I just want to confirm you are on.
Yes, can you hear me?
Yeah, I can. Okay, so we officially have quorum. It is 1:04, and I will turn it over to Jenna.
Thanks, Mary. So hello, everyone. Hope you're all doing well on this Tuesday afternoon. So I'm going to go ahead and do we do a roll call, Mary, or you have it? You have our attendance noted.
I have our attendance noted. If any council members do need to leave, please unmute yourself, let us know, because we have exactly enough for quorum at this moment.
Great. So I'll go ahead and call the meeting to order. It's 1:05 p.m. and welcome everyone. Thank you all for taking your time for our meeting today. We have lots of good stuff to talk about today, so thanks for being here. We'll go ahead and move through our agenda, starting with item number 2, which is public comment. If anyone has public comment, please go ahead and raise your hand or make a comment in the chat that you'd like to make the comment. Okay, hearing none, I will move forward with the approval of minutes from December 6th and 29th. Mary, can you share? I don't see the December 6th minutes.
The December 6th minutes didn't make it into the packet. So the only ones that you have are the ones for January 29th. I have about 4 pages of 16 of the December 6th left. So I will send those out for a early review before the next meeting, way early. I'll probably be sending them out in the next week because they are almost done.
Great. So for item number 3, we will just be approving the minutes from January 9th, 2024. And I will entertain a motion to approve the minutes. They are included in the packet and also available on the Part C ICC website.
And I sent those to the council last Friday as well.
Robin Kincaid, are you making a motion?
Actually, I wanted to see if I could just get a quick correction. Let me try to. Okay, it is on page 4. In the second paragraph, I think we need to. I don't think they're soggy questions. I think it's the soji questions. So if we could just fix that, just for later down the road, if we forget what that means. I think it's SOGI that needs to be there.
Yes.
I'm going to give anyone else a chance if there's some additional changes that they saw that need to be corrected.
So I ask again to entertain a motion to approve the January 29th minutes with the correction point Robin pointed out.
Let's see here. Where's that page? Page 8.
Yeah, Robin?
Yeah, one more correction. I don't mind making this. Okay. Oh, I see. It's the data system that maybe it isn't a correction. I lost my place. Excuse me, just 1 second. Okay, I'm fine. I'd like to make a motion to accept the minutes with that minor change.
This is Andre Haynes, and I second that motion.
Andre, we haven't gotten your reappointment yet, so I'm very thankful that you're
okay.
here. But until we get that, I can't count your vote. I'm sorry.
Okay, that's okay. That's okay.
Thank you, Andre. Is there an ICC member that will second the motion to approve the minutes with those corrections?
I'll second that motion.
Who is that?
Brittany Todd.
Brittany.
Oh no, that was Brittany.
Great. Any other further discussion? Okay. All those opposed to the motion to approve the minutes, you can raise your hand or say nay, I guess. Anyone abstaining from the motion? You can raise your hand or put it in the chat. Okay, motion passes. Thank you all for approving the minutes. Next, I'm going to ask Mary to scroll down a little bit. Item 4 is to share with you the letter that has been drafted, has not been sent, that we discussed at the last 2 meetings to talk about the, what was it, the SOGI data? I'm trying to think what it was.
Soggy.
Soggy data.
The soggy data.
I'm going to call it that from now on. The SOGI data with the department to ask them to either refrain from using it for EI or to include the script that we provided. So this is the full letters in the packet. We can also scroll for you as well. This is really for information only, but we wrote this. We wanted to share this with you before I kind of signed it and sent it off. But I will take any comments on it from council members if they have any. This was directly from our conversation that we had over the past two meetings. So we took the script that was developed, and then we took some kind of summary of our conversation. Hearing no I'm going to give another second. I feel like I need to wait another second on this one. Any comments or on this letter?
We're missing one quotation. If we want to close the quotation or remove it, I prefer not to disclose, but that's more just like a grammatical.
Yes. We will note it. I'll do a final read through as well. Thank you. Any other comments? Good. Well, thank you to the council for working on this, and we'll send, or Robin, did you have a comment?
I apologize. I do have a comment. So IDA requires that children are assessed using multidisciplinary team approach, but I don't know if multidisciplinary is really the appropriate word next to the state council. Maybe somebody can just clarify that.
Sure. I use that word to concisely describe the council, that we have people from different, backgrounds and different roles. Yeah. Instead of listing all of the roles that we have, I just put that.
Right. Right. I just didn't. Okay. I'm fine with that. I just wanted to clarify maybe kind of how that started, but that's fine. Just leave it the way it is. Thank you.
Yep. Melissa?
In the first line between Nevada's and Part C, I think it should say IDEA.
Thank you. I actually had that and then I moved it because I put it in the next sentence.
Okay.
So I'll put it back. Absolutely. Thanks for those edits. I appreciate it. Okay. Again, I want to thank the council for spending the time to work on this, and we will get this off, and we'll share with you any response that we receive on that moving forward. Great, so we're going to move on to item number 5, which is our ICC subcommittees. So for a quick background on our subcommittees, we have a couple subcommittees that are in our bylaws. We also have some committees that we can have in our bylaws that we don't have. Our subcommittees in general have been inactive for a little while. So we're going to take some time to just review all the subcommittees that we have, look at what we currently have as our membership of each of the subcommittees. We're basically looking at asking for, of the group, if we can today, and I know we don't have a lot of members here today, but asking for someone to self-nominate or nominate someone else for a chair nomination. And then I will work with that chair to help work on, between now and our July meeting, getting that subcommittee active, seeking out membership, working on a action plan and kind of goal plan to work on that. So what we're asking today is to, really our goal is to look at the membership confirmation, and then also, which means we can add to it, and ask for someone to volunteer to nominate themselves as a chair for that. And then I will work with people between this meeting and the next meeting to get action involved in there. The 3 committees that we have in our well, actually 2 of them in our bylaws, and we added a 3rd, are the Child Find Committee, the Family Support Committee, and the Equity Subcommittee. So we'll start with those. The other 2 committees are committees that we haven't used before. The membership committee is in our bylaws, but we haven't used it before, but we'd like to activate that at least in a short-term capacity. And then we're also asking for an ad hoc, a bylaw subcommittee to short-term committee to work on revising our bylaws, which we started together in Reno in October, September, whenever we were, October, it was October. So let's start with the Child Find Subcommittee. In your packets, you do have a list of the roster that we currently have with the Child Find Subcommittee. And I will say, if Mary, if you wouldn't mind scrolling, I'll talk a little about membership for a moment. The membership rules for the subcommittees are that they have to be chaired by an ICC member. The membership itself can include ICC members and non-members. As a note on size of committee, which has been a problem in the past, is that although we don't have a specific size of the committees stipulated, they have to be a size that you still have to meet open meeting laws, which includes you have to meet quorum to hold your meetings. So we don't want our committees to get so large that we can't meet quorum, which has been an issue for our committees. So those are just our membership rules. So actually, I don't know, maybe I'll turn this over to Mary if you have any other information about our current membership rosters.
Yeah, thank you. This is Mary Garrison for the record. I looked through all of our membership lists that, again, those go back some time and have not met in a while. I removed individuals who either are no longer part of the council, have not been a part of any meetings since leaving the council, or are no longer part of or have not attended any meetings in the recent past, or are no longer working in EI. So I left in here who I think may still be interested. Again, this isn't a definitive list because we're reconvening. So this could change, but this is who I found on the current list that we have. So each subcommittee has their own. So this first one that I'm showing right now is the Child Find Subcommittee. And this is who was listed for this subcommittee back when they met last. And it does go into the next page here. We had several other council members on this Child Find Subcommittee. This was the largest subcommittee of all and has the most council members. So as Jenna had stated, the more council members you have, the more you need for quorum, which has caused issues with being able to meet. As I scroll down, we have our Family Support Resource Subcommittee. This was supported by Dan Donnell from our office, who has since retired. And again, I looked through the membership, and this is who I have left of those individuals. So not too many. The only person who is an actual ICC member is Robin. And then we have our newest subcommittee that was formed is our equity subcommittee. And that was chaired by Abby, who is not Abby Chilipnik. She is not a ICC member, but Andre was at the time. And so if we do reconvene until we get Andre's reappointment completed with the governor's office, we would need a ICC member to co-chair. As Jenna had stated, it doesn't, the co-chairs, you could have two chairs. One can be a council member, one can be a non-council member, as you'll see with this equity subcommittee. That's how it was, which is helpful because then you can alternate. As Jenna knows, she's had to chair all meetings until we can maybe get a parent representative that would be interested in that co-chair position. It goes the same with subcommittees, but it does not require that they're both council members, just one. So again, this is informational. These are not definitive membership lists. Again, these probably will change, but I wanted to put them out there so that if you see your name, you make sure that you let us know as we talk more about this. And I see Sarah has her hand raised, so I will.
It was Sarah and then Melissa. Before we just want to add to, our goal today is really to establish really a chair or even an interim chair to help us in the next 3 months to kind of re-engage the committees, seek out membership, confirm membership, and make a plan to move forward. So why can't I see the hands up? So you can, Mary. So I think I definitely saw Melissa, and you said Sarah's hands up. So Melissa, do you want to go first and then Sarah?
I just wanted to point out that the Family Support or the Family Resource Subcommittee is what it was called before. That's where our calendar activity was for some of those activities, making sure that we have the best resources in the hands of families. And since we haven't had Dan's position filled, and because he was such a powerhouse so far as supporting families, I think that there's a lot that can be done with that. I know that we have family survey questions that we'd like to push to that group and to the equity subcommittee, as well as some of the reformatting of our reporting and making those things more accessible. So there are old activities that could be revived, and there are lots of new things for each of these different groups. So sorry, I know that you want to get to voting, but I did want to say that these aren't dead branches on a tree. These are vibrant and full of activities that will support our system. So thank you.
Yeah, thank you. Yeah, I think the point of really getting them up and moving again is to really jump into those activities that are happening somewhere else that need to be happening to support them too. Sarah.
Thank you, Jenna. This is Sarah Horseman for the record. What would be, looking at these membership lists, they're a little bit dated, and I know that's why we're looking at it. What would be the best way to update information, such as if somebody's retired, if there's a position change or role change, name change? Like, should we drop that now, or should we email Mary or you, Jenna?
Thank you. And that is part of one thing we need to do. I think if you know updated information, let's go ahead and email Mary. You can even copy me too. And I think that's part of what we'll do too is if we already know there's changes, I've noticed them too as well. We'll also then contact any of these people and say, you've been on this before, would you like to continue? And then working with the chairs to move it forward. I'm going to ask from the council as well too. I know that we only have half of the council members here today. If there are
Plus one.
people that are in, go ahead, +1, you're right, +1. I think if people are interested in chairing these committees now, you can let us know and we could vote on that. We also could send out a little survey if to the whole council, if there's people that aren't on this meeting today that also would be interested in that. Dutiful, thank you, Brittany. Just I want to make sure the other people that aren't on this meeting today, if they're interested in any of these subcommittees, that we do that. Lorianne, were you going to say something? No.
Hi, this is Lorianne Molina Level, Privacy Coordinator. Thank you, Jenna, and hello, everyone. We're so grateful for everyone being here with us today. Regarding the subcommittees, our office just wanted to make a suggestion. Just as Melissa had said, these are not activities that are like dead branches. They are thriving. In fact, for the Equity Subcommittee, one of the co-chairs, Abby Chalupnik, as well as several other individuals in ADSD are very active in equity endeavors. Some individuals are holding trainings, as Abby does. Others may be attending steering committee meetings at the DHHS level. And then there may be some other efforts occurring by locally by programs. Perhaps it could be a good idea if it is going to take time for the meetings to actually take place, and which depend on quorum. Perhaps it could be a good idea for programs to share out their updates. We know we can't do a work group with, a quorum of individuals from the ICC, but we are open to having a work group of individuals who, perhaps we could identify through that survey that you're mentioning, Jenna, that could continue to do some work together and then report out more broadly to the ICC subcommittee or the ICC. Thank you.
Absolutely. Thank you, Lorianne, for that. And I think part of what I will ask the subcommittee chairs to do is to kind of look around and examine activities that are happening related to your subcommittee, and then, how can the subcommittee support that work or take on that work or add to that work that's happening. There's a lot of amazing things happening in our state. So thank you. I have a follow-up to that too, but I know Sarah had a comment as well. So Sarah.
Oh, I put my hand down. That was the second part of my question you addressed, which was how can we share this to recruit people who aren't on ICC, but we'll figure that out.
Yeah, so that was actually what my thought too was, we can take input now, if you like, on how to recruit members outside the ICC. We obviously have people who attend, thank you all, who are attending the ICC meeting that are not ICC members, but we also, maybe I'll work with Lorianne and Mary on how we could share that a little bit more broadly to people coming, because there might also be other practitioners and family members or people working in the community that also might be included. So I will work on that in the interim. Mary.
Thank you, Jenna. This is Mary Garrison for the record. I will create a survey that I can send to the council as well as stakeholders, requesting their interest in joining a subcommittee if we have a quorum of council members, or if we choose to do a work group related to these items that reports back to the council. And that would come into play if, let's say, we only had one council member who was part of that work group. So it wouldn't necessarily be a group. It wouldn't be associated with the council, but they're there. But we could do that work, report back, and ask for stuff from the council as to what they would like to see done. So I'll put that out there in a forms. We use Microsoft Forms. It's what we have with the states, or we have SurveyMonkey, but I'll use Forms because pretty easily accessible for me.
Great.
And again, I'll send that to council members and stakeholders, so we get a broader selection there.
Great. Thanks, Mary. And I'm happy we already have descriptions for the Child Find and Family Support Resource and Equity Subcommittee. The membership subcommittee and the bylaw subcommittee, according to our bylaws, should be internal to just committee members. So when we put that out there, we'll also note that. So I'll ask the council your guidance on, are there people that would like to nominate themselves as chair now, or should we go ahead and put out a survey and then recontact people after that survey is out, but before our next meeting, so we can get some things moving? How would you all like to move forward on finding leadership for these subcommittees and then moving the membership and work plan forward for the subcommittees? Sarah.
This is Sarah Horseman for the record. I recommend that we nominate chairs now if we can. I know we don't have the whole council here. And then do we need to update some of the subcommittees? I know you mentioned there's some that have so they are required, Mary, to have an ICC member chair each committee. So we will need to reappoint some for some of these. So I recommend if we can nominate now, and then maybe in each of our resource circles, we can each reach out to at large the community for anyone that's interested. Open to thoughts, but that's my initial thought.
Thank you, Sarah. I also think there's other council members who aren't on this call who have expressed interest in particularly like the membership and the bylaws, ad hoc bylaws committee. So I think maybe we won't vote on them, but if we can, happy to reach out to them if no one here would like to do those. Are people comfortable with that? Are there people that are interested in chairing those subcommittees that are on the call? And then I'll go through them one by one. Okay, I'm going to start at the top then. Is there anyone interested in chairing the Child Find subcommittee? I'm hearing none. That's okay. We'll move on. Anyone interested in the family support resource, chairing the family support resource, oh God, sorry, family support resource subcommittee at this time? Previous in the past, it has been chaired by the person that in that position in the Part C office. Is not required, but that we don't have someone in that position currently, correct, Mary?
It was supported by Dan. He was not a chair, so he was like my role, but for this subcommittee, the chairs would, or one of the chairs at least, would have been a council member.
Okay, great. Is there any of the council members that would be interested in chairing that committee? Robin, are you raising your hand to volunteer, or do you have a comment?
Yeah, I'm raising my hand to volunteer.
Thank you.
But I would love to see any of the parent reps, if they would be willing to join this committee. I think we have a pretty narrow membership now.
Yeah.
So really could use some of the parent reps.
I agree.
And I can recruit from the outside parents that, that use our services, and would look for any that would come across anybody's radar. But right now, that subcommittee is going to need more members.
Mm-hmm. Yeah. Brittany? Okay.
Just a quick question, and I apologize if it's in the material somewhere that I'm overlooking. What are the frequency and the time requirements for each committee?
Sure. So I did not say that, so thank you for asking. We expect the subcommittees to meet quarterly, so 4 times a year. Meetings usually last, I would say an hour to 2 hours. They're shorter than our full council meetings. And then depending on what your tasks and your action plan is, there may be work to be done in between meetings. So the time commitment, if you're the chair, obviously it'll be more than that. You'll have to prepare for the meetings, which will help you with. Obviously conduct the meetings, and then depending on your action plan and tasks variable between meetings, I could give you an hour, I don't know, an hour estimate, but probably I would say 2 to 3 hours a month.
If that.
Yeah. It's really variable depending on your tasks. Yeah. It just went away from me. Julie.
Hi, Julie Dame. I would be interested in joining this committee and supporting as well with Robin.
Great, thank you. I also see in the chat that Lisa Hunt would also like to be on the subcommittee.
Yes, I would also like to be on this subcommittee. I'm just not sure I have the time commitment to be the chair. I'd like to potentially be the chair, but I definitely want to be on the committee.
Great, thank you. Anyone else for the family support? So what I will do is that Robin Kincaid has not self-nominated herself to chair this committee. No one else has nominated, so I will entertain a motion to elect Robin Kincaid the chair of the Family Support Resource Committee subcommittee.
Hi, this is
Do you need
Sandra
someone to
for the
second that?
record. Okay.
Sorry, this
you
is
ju-
Lisa Hunt, parent representative. I second the motion to nominate Robin Kincaid.
Great. So Sandra, were you making the motion and then Lisa seconded it?
Yes.
Okay, just want to check. So Mary, did you get that? So Sandra LaPalme has made a motion to elect Robin Kincaid as the chair for the Family Support Resource Subcommittee, and Lisa has seconded that. Any further discussion? Great. Anyone opposed to this motion? Anyone abstaining? Motion passes. Thank you very much, Robin. You are now the chair of the Family Support Resource Subcommittee. We've noted who on the call had wants to be on that committee, and then I'll work with you and we'll continue to build that committee. The next is the Equity Subcommittee. So I'm going to ask Lori Ann, and Andre, who were both co-chairs before. Abby is not on the call, correct? Oh, Abby, you are here. No.
I am here.
You are here. There you are. Oh, I'm muting myself. So you were past co-chairs of this committee, correct? Are you interested in still chairing the committee? And then we'll need to find a committee member to co-chair with the two of you.
This is Abby Chalupnik, I think I say for the record. I'm not sure if that's appropriate for this meeting or not, but I would be honored to be the chair or co-chair.
Thank you, Abby. Andre, are you interested in still staying as co-chair?
This is Andre. Yes, I am.
Great. Thank you. And until we get Andre officially on this council, is there a council member who would be interested in co-chairing with Abby and Andre for this subcommittee? I let my wait time go. I'm going to, so we will, in our call out, we will find a committee member to co-chair with the two of you. Let's go ahead and vote, even though you're technically still co-chairs of this committee, but I will entertain a motion to elect Abby and Andre as co-chairs for the equity subcommittee, with the action from me to help also solicit a committee member to co-chair with you for that committee. So I entertain a motion for that. Robin?
Yes, I'd like to entertain a motion to elect it's Abby and Andre to be co-chairs for the equity subcommittee.
Great, thank you. Do we have a second?
This is Julie Dame. I'll second the motion.
Great. Thank you very much. Do we have any discussion? Okay. Anyone opposed to this motion? Anyone abstaining from this motion? Motion passes. Thank you so much to Abby and Andre for co-chairing the equity subcommittee, and we will also find you a council member to co-chair that with you. Beautiful, wonderful. Next, we have the membership subcommittee. This is also part of our bylaws. The membership subcommittee does have to be created of council members. We're really looking for like 3 people or so. This committee will really be focused on helping us recruit members to the council, to create a full roster for our council, and then also work with continual recruitment as all of our terms run and cycle through, so we have a nice, strong, and balanced council. Is there anyone interested in being on this committee or chairing this committee, the subcommittee?
Brittany Toth, for the record, I'm interested in being on the committee.
Great, thank you. Anyone else interested in being on the committee? We will put that out to other folks. I know there's some other people that aren't on today that might be interested. So we'll connect with the other council members and find Brittany some colleagues to work with on this subcommittee. So thank you for that. The last is the ad hoc committee, the bylaws subcommittee. This will be a short-term committee. Hopefully, well, I don't want to give a time frame, but within the year, to really look at continuing our bylaws revision process that we started in October. There are some people who have already been working on this. They are not on the call, so I will connect with them. But is there anyone on the call that would be interested in being on this? This is, again, 3 to 4 people committee. Is there anyone interested in being on this committee or chairing this committee? No one's really jumping into the bylaws work. Great. So Robin says she's interested in being on the committee. Thank you.
This is Mary for the record. I have a feeling Janice will probably, and she unfortunately couldn't be here today. So we'll get those individuals through that survey, I'm pretty sure.
Great, thank you.
Thank you, Robin.
Yeah, thank you. I didn't want to like put her name. I know that she's interested.
Yeah.
I'm also happy to be on this committee.
Good.
But I don't want to chair it because I feel like it's a conflict. But I'm happy to be on the committee. Okay, so thank you everyone who already volunteered. If you can still, obviously, if you still are thinking about things, that's okay too. We'll go ahead and put out a survey to gather more interest and information from people. And then all of the chairs, I will contact you and we'll kind of work on some strategies and some goals to move it forward. And when we get into and what we want to accomplish by our July meeting. and then move forward there. So thank you all for that. I know subcommittee work isn't, I think it's always fun and interesting because you get to do things, but I also know everyone's time is valuable. So we'll make a plan that it is as effective and efficient as possible. So thank you for that. I really appreciate it. I'm going to move on to our next agenda item, which is agenda item 6, looking at my Roman numerals. And I'm going to turn this over to Sarah mostly. I know you're going to pull in Lorianne at some point too, but I'm going to turn it right over to you.
Thank you. This is Sarah Horseman for the record. So for our first update, we just wanted to provide the council more information on our Nevada Early Intervention Data System, which acronyms for NEEDS. We went live with billing in the system-wide for all programs December 1st, which I know we shared at our last ICC meeting in January. Right now, legacy systems are only accessed for records and for Part C monitoring. We're still in the process of working with the vendor. There is some identified issues with insurance payments. It's multi-factored. There's several different layers. There's been user errors, cleanup issues, but there's a lot of back-end issues and design. Sorry to use the word issues again, but that have caused some backlog. So we're working diligently to identify that. Specifically on the community provider end, we've had trouble with getting reimbursement from Medicaid and from private insurance to show up. And there's, like I said, there's multi-layers with that, including trying to figure out how to get remittance advice files in to the system so we can reconcile payments. So we're working on that, but everyone has been using the same system since December 1st, and we host an ADSD hosts in conjunction with Part C an open office hours every month for community providers to come and work through issues. And that also is helpful for us to identify things that need to be addressed on in our user acceptance testing log. We also do the same thing for state providers. We also have run into a lot of reporting challenges, which we knew as we were in the discovery design phase of this project. So there is some reporting that we are still trying to figure out. We're asking for additional features. I know that's both on the state and the Part C side. Another thing I wanted to address, and I know it was a requested item, which is also under the Part C updates, but I wanted to share on the ADSD side. I know there was a question about how we're working to increase Medicaid revenue. So on the service agreement side, and with our state providers, we have made it a requirement that everybody is credentialed through the Council for Affordable Quality Healthcare, CAQH, which is a portal, a centralized portal where providers have to be credentialed by insurance and Medicaid, and they have to reattest every quarter. So we require that for state providers. We also implemented last month, ADSD implemented a requirement for programs to check Medicaid every month, Medicaid enrollment to verify, and then to change, to update the needs system because everything's really connected. So on the state side, we require developmental specialists to to check the electronic verification system every month, and then to update needs as required. And then we also issued the same requirement to community providers, and they were given the option of who would be the designated person to check for their program. We've also, we're revisiting every year. We require community providers to sign our billing guidelines and to look at our scopes of work. So as we've been continuing in needs, we've been increasing, and with learning in the insurance piece, we've been increasing, strengthening the language in that service agreement to ensure we're billing to full capacity. So I don't know if there's any questions more specific, and I think Lorianne was going to speak more under the Part C updates, but that is on the ADSD side what we're doing. Oh, and I missed one big thing is that ADSD worked with Medicaid for years, and now they have finally agreed for fee for service. They have removed the their prior authorization requirement. So it's in line with what a lot of states have been doing, in which they honor the IFSP as the prior authorization for Medicaid fee for service. And that provides a lot of benefits to the family and to the program. We're still working with the managed care organizations, and we know that Medicaid has a plan to expand managed care organizations. So we don't have an update on that yet, but those are the efforts we've been doing to increase Medicaid revenue. I don't know if there's any questions before we move on to the next topic. Okay, I'm going to turn it over to Fatima Taylor to discuss the process for closing community providers.
Good afternoon, Fatima Taylor for the record. For the closeout for a service agreement for a community provider, I'll review just high level of the process. So when we go through a program closeout, it typically is because either a contract has expired with no intent to renew or the contract has been terminated. Or they just decide not to renew the contract. Then the provider will reach out to ADSD and then follow the closeout process that is a lot outlined specifically in the service agreement. So the provider will know all the steps that they will need to take. At the time of notification that a service agreement will be not renewed or terminated, they will be signed a contract, contract closeout team is what we call it. And so that designated team will be the point of contact for that particular provider as they go through this process. That contract closeout team will coordinate and collaborate with the Children's Services, ADSD Children's Services QA team, as well as the IDEA Part C office. And we'll do what we call joint meetings with that provider, as well as the other community providers, to discuss how this transition process will look as far as where families will go. So we do check with the remaining providers in the system of how many children that they would be able to take for that program that is closing. And then we designate those numbers. And then once we know what community providers can take which number of kids, then the state typically takes the remainder if needed. And so we set up weekly meetings to go through with the program as well as the other community providers, so that we are aware of anything that we need to know as far as comps that may be owed to these families. So we have those discussions and talk through those things so that we can make some informed decisions and make sure that families get to a placement where a program can manage not only the current services, but the compensatory services if needed. They also are, when we have our actual kids transfer, we also meet with the community providers or state programs who receive those transfer assignments. We make sure that they get the record complete and they know exactly what compensatory services are owed. I'll back up just a little bit. When we are working with the quality assurance team, they are reaching out to families and letting them know that the program is closing and that they can choose another program. If they don't have a program choice, then we do rotation similar to what we do when they come in as referrals. And so all of those families do have a choice of what new program they would like to attend if available. And then if Part C determines there's non-compliance or there's other concerns for having to do a chart review, they may do a focused monitoring if needed to deal with some of those compliance issues so we can get resolution as we move forward and so forth. So that is a high level view of what we do for our closeout process. I do want to add that when we take the records, the state does take a hold of all of those records from those programs. So they do submit their active records so we can get those disseminated to those programs who accepted those families. And then we also archive the other records that are exited or decided to they exited because of H3 or they chose to close out services. So we do archive those records. So when families do want a records request, they will have to go through ADSD to access those records. So I'm not sure if there's any questions, but that is kind of that high level review of our closeout process. Yes,
Robin?
Yeah, I just had a quick question. So just make sure I'm clear. Is this particular process that you're describing just on paper? Has it actually been, I don't need to know a name of any program. I just want to know, has it been tested or actually implemented? And I mean, anytime you put something down on paper, once you kind of like go through it and test it, then you make revisions and changes. I'm just trying to understand where you are in the process.
With the service agreement, it is outlined in the service agreement, and we stick pretty closely to the service agreement. There could be situations where it not necessarily not a fit, because I think the service agreement is broad enough to handle most situations, but there are times that we may have to come together and have discussions of what actions may need to be taken and how swiftly action may need to be taken in order to have resolution with the transition of closing out that contract. Did that answer your question, Robin?
Yeah, I guess, yeah. So, I mean, I understand you have to sometimes individualize it. So, I mean, that's fine. You have to do what you do, especially if you need to act quickly for whatever reason. But I was just wondering if you've actually implemented this as it's written on paper,
Yes.
or is this just in case this should occur?
No, we follow the service agreement outline. And then, like you said, everything evolves with time. So the way we might determine a focus monitoring, we might be a little bit more seasoned. Not that you want to be seasoned in transition closeouts, but you might be a little bit more seasoned, and lessons learned from the previous, you can smooth that out. And so I think the last program closeout transition we had for Continuum Positively Kids, I think those processes went as smooth as they could from our lessons learned from previous ones, but they're not easy to go through for the system. It's a burden on the system. It's unfortunate for families to have to do that transition. It really is a hardship on the system all around when we lose a program. So that is something we really work hard to not happen. So when it does happen, it is unfortunate.
One last follow-up question. This is Robin Kincaid. How are the families notified that there's an impending closure of a program that's serving them?
So they will get a phone call as well as a written communication from either by mail or email from the quality assurance team. Typically will step in and do that. It's not, the state doesn't, EI programs don't step in and do that, nor does Part C QA takes that lead.
Okay. Thank you.
Sarah, did you want to add anything?
Yeah, this is Sarah Horseman for the record. I just wanted to add just to respond more to you, Robin, your question. Like Fatima said, we've had, I think with the last two closures, we've had really, we've followed the structure really well, and we've had really good partnership with the other community providers. So we would implement weekly meetings. There would be a lot of updates, touch points, a lot of communication on all ends, so that and with the program that's closing, so that all things come together, including QA would come on and provide updates with who parents are choosing. They kind of help identify how many they can take. So both times, with Continuum, we kind of restructured it, like Fatima said, from the previous two. And then we had we had implemented that same structure when for Positively Kids.
Thank you.
This is Jenna Weglersworth for the record. I have a question for you all too. In addition to the families, are there any processes involved that help providers transition to a new program?
Usually for, yeah. Oh, go ahead, Lorianne. Did you want to speak to that?
Thank you, Fatima, and thank you, Jenna, for the question. This is Lorianne Molina Level. I would be happy to share our efforts to assist providers who are in that transition between a program that's closing and then those providers in need of employment. In addition to that really thorough process, thank you to Fatima and Sarah for that explanation. ADSD and NEIS, they do a fantastic job of being very thorough, working those very long hours to accomplish this very straightforward process according to the service agreement. But then we want to consider that there are professionals who are in need of employment, and so we do let the providers know that they can reach out to us, and we can also reach out to the other existing programs to see if anyone is hiring. And then what providers will do is if they are interested in remaining in EI, they can send their resumes to our office, and either myself or one of our Part C liaisons can forward those resumes and any letters of recommendation on to the programs that are in the process of hiring or recruiting. And we have seen that occur from these last couple of programs that did close out within the last 2 years, where we were sending over resumes, and we did see some of those employees get hired at the existing programs. And I also wanted to touch on some other processes for the closeout. We heard a lot about what's happening at the child and family level for their records and the continuity of services. There's some other pieces as well that our Part C office will participate in, although it's kind of a little later down the line. The program that is closing out, they still will need to do their invoice process for their final months or weeks of providing services in our system. So after they do their process with ADSD and their fiscal office, then we'll do the final pay portion from our federal funding to reimburse ADSD for that. So there are some other areas in addition to child records that we collaborate with, and that ADSD does a phenomenal job in making sure all the loops are closed. So I just wanted to touch on that. Thank you.
Any other questions on this item? Great. So Sarah, you can go ahead and continue with your updates.
Thank you. For the in-person and telehealth report, our management analyst team has been understaffed for a couple of months now. So we unfortunately do not have an update for the council. I know in previous reports that we have shared, the system as a whole is moving very close to full in-person services. We did issue a telehealth report or a telehealth memo in conjunction with Part C some time ago. We may have shared that. I think it has been shared with the council. So community providers are required to disclose to us if telehealth is their only method of service delivery that they're able to deliver. So far, we don't have any programs reporting that to us. So families should be able to choose in-person services should be their primary service delivery. Like I said, we don't have the current data right now. We hopefully will have that by the July meeting, but I don't know if any council members had questions about service delivery methods. Right now, it would be anecdotal. If other programs are on, they could share. And then for program highlights, I don't know if there is written updates in the packet, but I know we had discussed having, oh, there is some written ones. Thank you, Mary. And I don't know if we had discussed having a programs or having at least one program that wanted to provide live updates to the council.
We had discussed that. I'm going to throw it back to Mary and see if there was a program that wanted to share out their update.
I did ask programs if you did not want to send in a written update, you are welcome to share with the council during today's call. I think, let's see, this goes on to the next page. So we have TMG, NEIS South, TheraPlay Solutions, and MDDA sent in written updates. So if there's any other programs, community, or state on the call that would like to share any updates, we'd be happy to hear from you.
I'll say in future meetings, we will be more intentional about inviting programs and also families to share, you know, their updates and experiences. So that'll be in future meetings coming up.
And this is Sarah Horseman for the record. We hear program updates too from providers. So I know that there's great things going on in programs, but I won't call upon anybody, and we'll make sure that people have preparation for that. But that is all for our ADST updates.
Great. Thank you. Yeah, and we'll work with programs moving forward on kind of like a template or kind of example of how to share the amazing things that are happening in their programs. So look forward to that in future meetings starting in the fall. I'm going to turn it over to Lorianne and Maya for our PD Center updates.
Thank you, Jenna. Hi again, this is Lorianne Molina Lovell for the record. And joining me today is our PD Center, Maya Raimondi. Maya, you want to say hello?
Hello, everyone.
And so we're happy to share out some updates for you regarding our Professional Development Center. For those of you who may be new to the ICC, we can give you a quick historical timeline. So our system, like the rest of the nation, experienced the phenomenon called the Great Resignation that was occurring across the country in just about every field and industry during the pandemic. And for us, that was during 2021 to 2022, when we had approximately 10% of our developmental specialist positions resign for various reasons. But by and large, we had heard and had received feedback from programs that a huge factor for that was some of the barriers developmental specialists were facing to obtain their necessary coursework required for them to maintain their position. And so a PD work group formed to address these retention issues, and with the support of the Governor's Finance Office, we received American Rescue Plan funds, and with the support of stakeholders and technical assistance centers nationwide, and institutions of higher ed, and state and community programs at local and state levels, we moved forward to develop the Nevada Early Intervention Professional Development Center, or for short, we say PD Center. The focus for this center was at first to be a workforce retention initiative for the developmental specialist position, with an eye to the future to also support other positions in the EI system, which are in the process of being brainstormed and evolving. But we have successfully completed our first cohort of the Developmental Specialist Series, which is a series of 6 courses that are comparable to those courses offered at institutions of higher ed, which the learners can obtain at no cost. And I know that the information on the screen says 19 learners, but we actually do have 20 learners that graduated. We had one that had a baby in the final week of the course, but she was able to still graduate and present her final capstone project. And so that number now is updated to 20 learners have graduated. And that really has impacted several hundred of families who now have continuity of services and can rely on their IFSP team to remain with that lead, with that developmental specialist leading their IFSP team and teaming with other IFSP team members. That has also brought an impact for each learner for their own personal savings, financially and for time, and impacted their professional careers. We had surveyed our graduates, and we had seen the trend is that these learners would like to remain working in the EI field as they have now earned their alternative certifications. You can see the savings there. These savings have a range estimated based on the cost of tuition and fees at various institutions of higher ed. We researched the costs for tuition at the upper undergraduate and graduate level for these courses that could be obtained at UNLV, UNR, and Grand Canyon University. The lower range is for those individuals who already have health insurance, as they can have that university health insurance requirement waived. And then that higher end number, the 284,000, that number is higher because for universities that will incur extra charges if an individual does not have insurance. And so in our EI system, there are some learners who work for programs that do have insurance, and there are some, usually in the private sector, that may not have their insurance, and so they will be paying those higher costs of tuition. In addition to the tuition, we also added in the cost to obtain their professional educator's license, which is the equivalent at the Department of Ed level. And so this for you is just a little snapshot of the impact that our system has made for these learners to continue their employment. We look forward to the next cohort of learners, which will be cohort 2, that will be graduating this August. And there will be approximately 20 individuals as well. And then cohort 3, which just began last month, they will be graduating this time next year, April of 2025. Cohort 4 is on track to begin this September. So the goal is to have 2 cohorts occurring every year, starting in March and September, with the entire program lasting about 12 to 13 months. And so as we surveyed our graduates, we did receive some great feedback, and Maya is going to share out for you some of the highlights of that feedback for how there was actually personal impact made for these learners. Maya?
Yes, thank you, Lori. From the feedback that we received from the learners, many of them had expressed that if it wasn't for this series and this program available to them at no cost, that unfortunately they would not be able to remain in the early intervention programs that they were currently employed at. So they were very grateful. We did have a particular learner who is a single mom who stated that she could not have afforded to go back to school to obtain her credential through the higher education system, such as UNLV or Grand Canyon, that it just was not feasible for her in her current financial situation. So she was very grateful and expressed her gratitude because she loves the field of EI and is so grateful that now she's able to move forward with and keep her position. As well as we have several learners who are in the rural communities, such as Elko, and that they do not have access to the same educational programs that maybe someone who's up north or in Las Vegas does. And so they were very grateful as well. And one learner in particular who created a training for her capstone presentation actually presented it to her whole office out there in Elko. So she was very proud of that. We're very proud of the work that she's done out there as well. The overall feedback that we received was that because of this program, they no longer had to worry about either the financial costs that come with receiving their certification the traditional way through a university system. So overall, we received incredible feedback. It was very endearing and wonderful to be a part of this journey for so many learners. But many of them expressed how, because of this program, they are now able to stay in a field that they love to be a part of and continue their employment and their work with the families.
Thank you, Maya. This is Lorianne Molina Level. I wanted to also add that these learners have shared with us that they would like to go on to more higher education. And now that they can focus on their own interests because they have met these requirements for their position, they can focus on their own interests for a major that perhaps they did not want to major in early childhood special education, but wanted to study in another area, that they can now use their funding or their financial aid to obtain those, to meet those goals, their personal goals. So that's very exciting. You know, throughout the process, we're encouraging all learners to continue to explore their options for the institutions of higher ed. And we encourage them to really consider that as they make their decision for whether to pursue the alternative certification or to pursue traditional higher ed. And we are here to support learners even if they choose not to follow to go through the path of the DS series. We're still here where the learners who may go on to higher ed institutions can still utilize our resources, our academic research platform subscription, and receive overall advising if needed. I'd like to share briefly about how we're sustaining programs. And Maya, I'll ask you in a moment if you also want to share your thoughts about our volunteer instructors. So a huge part of sustaining this project is funding and the volunteer instructors that are providing the instruction for our courses. So the funding we have from the Governor's Finance Office is set to go all the way through June of 2026. And that will cover the salary for our contractor, for our PD Center Director. And also will cover the costs of any textbooks, which we try to order digital ones now, which Mary does a great job of helping us get those resources. And any promotional or outreach items so that we can continue to build buy-in, support, and excitement and awareness for the services attached to this program. So we do have some instructor-only incentives where we provide, you know, different types of swag. We have tumblers with our waterfall logo. We have earbuds, Rubik's Cubes, backpacks, lunch totes, and just a number of many items which Mary and our PD work group have reviewed and approved and ordered with the GFO's approval. One of the incentives we had for the learners, which we hope will continue to catch fire and support the interest for the program, is gas gift cards. So part of the requirements for completing the DS series coursework is a practicum piece, which must entail a learner's work with families in the field. And so part of their assignments do include reporting about that in the identified ways. And so because practicum does mean they're commuting to families' homes or going to visits in the community, the GFO approved our request to purchase $25 gas cards for 50 learners. So the first cohort received their gas gift cards right before graduation, and we're looking forward to sending the next batch over to the cohort 2. But regarding the volunteer instructors, they are just an exceptional breed. And I'm going to ask Maya to share out about them and some of the feedback we've received from these wonderful instructors whose sole purpose really is to seed plant seeds into the system to help employees maintain their employment and for families to continue to receive their services on time. So Maya, can you share out about our wonderful PD instructors?
Yes, thank you, Lori. We have a few current volunteer instructors who are currently either, I believe that they are supervisors within the EI system and developmental specialists who have volunteered their time to make sure that the content, the courses that are offered are current with current information as well. We do have a very diverse group of learners. They can either have been in the EI system for quite some time or they're new DSs who are just starting out. So having that these individuals volunteer their time plus their years of expertise has been invaluable. And we've received wonderful feedback from the learners who have said they really have appreciated the not only the volunteer instructors, but also the guest speakers who have been OT, occupational therapists, speech therapists, I mean, a whole diverse group, audiologists within the community and community partners. They've really been able to help the learners identify specific, content and understand diagnosis more, I guess, become familiar with strategies to assist some of these families more that they weren't aware of. And so what we've been trying to do, especially with the guest speakers and the volunteers, is really hone in on what the learners want to learn about. And so far, I mean, we also have had wonderful, I don't want to leave out Abby, who have volunteered, and our own Jennifer Kellogg, who have been fantastic instructors as well. So it really does take a village to help with this whole learner series experience, but we've gotten great feedback, and we honestly couldn't have done it without the help with, I just a shout out to Bridget and Kristen, who have helped us immensely throughout this whole process. And if I've left anyone out who started before me, I apologize. Oh, we got a question.
Yes, we want to also highlight Sarah Sills and Karen Frisk and Lauren Gonzalez, who, in addition to Kristen Sullivan and Bridget Yuri Goritz, were just phenomenal instructors for us. We do have a hand raised, Sarah.
Thank you, Lorianne, and thank you, Maya. I did want to clarify that those volunteer instructors are state employees, so they are doing it on state time. So I just wanted to let the council know that it's during state time and it's not outside of work hours.
Right. Thank you, Sarah. We do have one individual from the community, but she is not attached to any of the EI programs, but rather is working in the private sector in a therapy clinic. Alicia Young, she is also our standing instructor for our first course in Foundations and Development. So we really appreciate her. And, some of the sustainability efforts that we are employing to maintain this pool of instructors, because instructors may experience different seasons of workload and their own assignments. And so instructors may come in and come out at different seasons. But one thing we are doing this year to support the professional development for the instructors themselves is to cover their travel for the upcoming DEC, the Division for Early Childhood International Conference. And I'd like to just speak a little bit about conferences. We were really honored to be selected to present about the PD Center a couple of weeks ago in Reno when ADSD hosted this lovely conference that occurred across a few days just a couple of weeks ago. It was held at the Atlantis. And we were asked to send in a proposal, and we did. And then they selected us. So we were so honored. And we were just tickled by their theme that the conference host had selected, which was a Star Wars The Force Awakens theme. And it made planning so much fun. We were given 75 minutes to share about our PD Center, lessons learned, so that those in the audience could perhaps replicate the work we've done in case they are looking to do something like that for their programs. We shared about the impact, and we really enjoyed sharing about the capstones, the learner capstones. So we highlighted several capstones. Some of the ones that were really memorable were one learner created an app. She mapped out what an app could look like to empower families, and she is in the process of engineering that. And that learner actually graduated and is going on to Duke University for OT school, and said she would like to come back and be an instructor for us. We had some other capstones that had some really nice ideas of collaborations in the community. One was regarding childcare and collaborating with childcare professionals for children who are receiving early intervention, possibly at childcare. So there was a learner who created specific documentation pieces and forms that could be used to bridge communication for childcare workers and EI professionals and the family. And then there were some other capstones we highlighted that covered mental health supports and how to support families who are grieving after, receiving the shock of a lifetime with a diagnosis for their child, which they couldn't have imagined was going to happen. So that's just a few of the highlights of the capstones. But we really had a lot of fun in that conference, especially with the Star Wars theme. Our team had donated some fun giveaways for the audience to keep the audience engaged. Because it was a Star Wars theme, we had some fun things like lightsaber glow in the dark chopsticks. And so that was a lot of fun. And we would ask audience questions such as, what their favorite character in Star Wars, or we even asked someone if they would be willing to make the sound that Chewbacca makes. And someone did the whole trilling of their tongue. And because she did that for Chewbacca's character, she received the prize. So that was a lot of fun, and just one of the examples of some of the interactions that occurred during that conference. And we look forward to sharing out about the PD Center with anyone who asks. So we're very fortunate that we were asked at a national level to share out next month in the DEC, the Division for Early Childhood, in their community of practice, or their COP. So their community of practice that they schedule every other month regarding professional development falls in May, and they reached out to us to see if we would be willing to share about our Grow Your Own program. And we said, yes, we would love to share that. If we can help anyone else, we would be really grateful to do that, because we learned from other states to do this, to do what we did. And so we actually learned from Tennessee, from the University of Tennessee. They were doing a similar program, but they were doing it for their school age, for their elementary school teachers, to be able to work, earn a living, and go to school at no cost and earn their teacher licenses. So that's where we were inspired, and we hope that we can pass it on and move it, pay it forward. So we'll be, Maya and I will be presenting on May 14th for the DEC's National COP about the Grow Your Own. We have about 30 minutes, so it's a lot shorter time frame, so we won't be able to do the fun Star Wars slides that we had. And then very, very honored, I'm not sure if we shared this. I don't think we shared this last ICC meeting in January, because we had just found out, I believe in February or March. So we did submit 2 proposals for the DEC International Conference, which will be held during September in New Orleans. And we were selected for both of our proposals. And so we're very, very humbled and very grateful that they were interested in that. So we will be having a poster presentation and a 60-minute in session presentation. And we want to thank you, Jenna, because you took time to look at our proposals, and we really appreciated that, because I think it was a really busy week for you, and you took time to send us a little feedback, and that that was really appreciated. So we look forward to sharing out with you in October, which will be the next ICC meeting following the DEC conference. Just very honored to be able to be a part of this all. Maya, is there anything else you'd like to share before we start to wrap up for the PD Center? Or maybe Mary'd like to share something. Mary was there at the conference with us, as well as some on the call.
I didn't know if Mary was going to share, but no, thank you, Lori. I appreciate you adding all that information, but I think you covered all the bases. I'm just very much looking forward to presenting and about the PD Center and the upcoming conferences. But it's been a great experience, and I'm looking forward to our future capstones with our future graduates. So yeah, I don't know if Mary wanted to add anything.
I won't add much because it looks like we're going to lose Brittany in a little bit here. And we have one other section to get to, but they did a fabulous job, Maya and Lorianne. And it was an honor to be there and see that. And I'm so grateful that Fatima was also there and we got to honor her as the person who brought this idea initially years ago to the EI system. So that was very lovely to see.
Thank you, Mary. Yes, we did take a moment to recognize Fatima as our thought leader in all of this, because she had this idea about the DS series back in 2016. I'm not sure if all of you knew that. We have presented on this in a number of platforms, but we hope that you know that the system maybe wasn't ready yet for that information or those, very forward-thinking ideas. And it would take up a pandemic for things to be able to roll out for what we have done by just, again, the work of many hands, many hearts at all levels, local, state, national levels receiving support. So received a lot of help, and we're grateful for everyone participating with us. I think that will round out this PD Center topic, unless anyone has any questions. Okay, I don't think we have any questions, Mary and Jenna.
Yeah, I don't see any. So we'll move on. Yeah, I do want to note that we're going to lose quorum in about 28 minutes. So no rush, but
Or less.
we have a couple, yeah, or less. So we have a couple, we have our Part C office report, and then a couple other quick items to do at the end. So Lorianne, or whoever from the Part C office is going to take some of these, go right ahead.
That's me. This is Mary for the record. I'm going to take number or letter A here for the Project Assist updated log. I did send out a log that I created. It's pretty simple, but it will give us some data that the previous log did not provide. We want to know, what are the reasons that people are calling? How are we assisting those individuals? The log that I sent out also includes a section for phone numbers and names of individuals that are calling, the date that they call. That will help us to better track what areas we're getting calls for and where we're sending them. So I do ask that if you have any feedback, if you could send that to me via email, I can get that updated, and we're going to backlog anything that we receive starting tomorrow and put it on that new log. So it'll be effective as of May 1st, even though I'm giving everybody till Friday to give me their feedback. We're just going to hold on to those and log them once we have that finalized on Friday. And I think that's all I have to say about the Project Assist log that was updated. Does anybody have any questions? Our previous log is completely corrupted. So we've been notating all the calls, but it's not, again, the previous log didn't really give us much info, just how many calls per month. That was it. Doesn't really help us. So we'll move forward with something better that's going to give us some information and good data to go forward. Okay, complaint log. That's not me.
Thanks, Mary. Hi, this is Lorianne Molina Level for the record. We traditionally and historically have asked India Morgan, our Part C liaison to share out about that, but I'm not sure if India is with us at the moment. So I can share out about that. So there on the screen before you is our complaint log.
Can you hear
And this
me?
is shared. Oh, is that you, India?
It is. Sorry, I was trying to find the mute button. I'm joining from my phone because I had been in transit, but I am here.
Oh, wonderful. Thank you, India. Are you able to share out about the complaint investigation log?
I am. And
And
so, and this
these
is
were
India
shared
Morgan with,
previous too, but there are some
Mhm.
updates that have happened. So
Yes, thank you, Mary. This is India Morgan for the record. And we do have just some very good updates with 2 complaints that are still pending correction right now. It is, and Pam, if you're on, you'll have to help me with the number of the one that you led. I believe it was 2024-01. And I don't know if you guys have the log in front of you. I can't see it right now, but just an update with that one. The program is in process of providing compensatory services for speech to that family. And so once those services have been completed and the documentation for all of the completion of those services have been verified, we will be able to close out that complaint. Similarly, a update for the 2024-02 complaint. Compensatory services are also in process for that family. And just as I stated for the previous one, once we are able to verify the supporting documentation that all of those services for vision have been completed, we will be able to close that one out as well. Are there any questions?
Hi, India. This is Lorianne. And as we wait to see if there are any questions, I also wanted to add an update for 2024-02.
Thank you, Lorianne.
So, yes, thank you very much. This is Lorianne Molina Level for the record. So the complaint, or I should say the dispute resolution for dispute resolution number 2024-02 did encompass a complaint, a mediation, and a filing for a due process hearing. However, the required resolution session that occurs before a due process hearing was scheduled and completed with the family and the program, and an agreement was reached, which is considered a resolution agreement, and that has been agreed to by the family and the program. And so the due process hearing was dropped, but we just wanted to give an update about that. And as India had stated, the compensatory services are in process along with other action pieces required by the program. We wanted to also highlight those dispute resolution process pieces are very important to our system. And we were actually advised by OSIP to follow the process, which Part B, which is the system of services for children ages 3 to 21, to follow their processes. And they list their complaint reports and dispute resolution information for each individual student onto their website. They organize that by year and by county. And so our Part C office is in process of adopting those practices. It will take us some time to revamp our website, but that planning is already underway. And we have been in touch with OSIP and our programs, ADSD, about that, that upcoming information for the website. We do believe that when that information is made available in a de-identified way, that it will be very beneficial and useful to the public as families can learn from other families that needed to use their voice and advocate for their rights. We also believe that this will increase the knowledge in the system that programs and professionals can also learn from as they learn from these actual cases or case studies. Again, to learn about compliance and aligning their practices with IDEA. Do we have any questions about the complaint log? Okay, and it looks like we have yellow bar data on the screen at this point. If there are no questions, I don't see any or hear any. At this point, the data sharing is usually shared out by our data manager, Melissa Sladen.
Thanks, Lorianne. The first quarter of the yellow bar report for the current fiscal year is in there. The second quarter is taking me longer than I had hoped, but not necessarily as long as I had expected, because that quarter specifically straddles two different data systems, and because our current data system needs has the billing connected with it, and we're trying to validate and get our Medicaid dollars in order and all of that. Those data are not what I would call valid and reliable yet. So we're working on it. I know that Sarah touched on the issues that the system is having, but these are the data available in the yellow bar report as it is for the first quarter. Sorry about not getting the second quarter to you yet. I expect to have through fourth quarter by your August meeting, as those are the dates I see in the last item that we need to get to. Mary, will you scroll down to the bottom of this yellow bar report, please? So you'll see grayed out boxes here. I've added 3 or 4 sections to this report. We should have the ability by third quarter that started in January to be able to have those services that occur within the natural environment. When we look at natural environment, we look at the number of children receiving services and if all their services are in the natural environment or if they have exceptions. And then we look at the number of services also. And then there is a section for that mimics this for whether or not services are received in a timely manner. Thank you, Mary. So those pieces can all come from needs. And then if I can skip to the next item that I was going to do with the delayed services report. I saw Jenna nod, so I'm taking that as a yes. I quickly pulled these today, and these are just the summary pieces that you'll see here. This is where I'm talking not valid and reliable, and no offense to the system as a whole to say that. That's OSEP's words, and so when it comes to when we can't validate our data, it's not valid or reliable. So this is the time span from July through the end of March. And it's showing that 75% of our services were untimely. I'm not saying that's unlikely. I know it to be not true. And so this has to do with the date that services were entered versus when they began. Those timely services are your 30 days. So if a service started before we started in needs, and then we had to start entering service logs in December, all of those visits that might have occurred between July 1st and December 1st, because we didn't start putting in notes in until then because of our billing match, they show as late. And so I don't want to freak anyone out, but I know that this is not true. And because there are 12,000 different services here, those will have to be validated as individual lines. I have 2 more of these reports for shorter time periods. This is the timely service delivery report from January through April. I have a summary by program. In the system, it calls them districts. This is number of children's and the number of children's, my goodness. And then our number of services here. So another 6,000 inclusive within the first data set that I showed you, it's still showing that services within programs are 70% untimely or 50% untimely by service. And then our last one, let's see, nope, that's the one we just looked at, is just the months of March and April. And these are by the date that the service should have started. 1,000 services in there, it's still showing a 65% untimely and 50% untimely. So again, those data will exist in the system. We will be able to report on them because we are in a transition year. And this is across all of our reports and speaks to the issues that Sarah was speaking to. It speaks to dollar bringing in money for the service logs. These are all intertwined. And so this is, those really gnarly looking numbers are just a symptom of what's going on in the system that we're not able to report on correctly yet. So I believe those are my two pieces. Mary?
I just want to bump in and say thank you, Melissa, for trying to do anything with the data in between the data systems. I know it's really complicated, and thank you for managing both systems at the same time. And just for that,
Well, and,
explaining why it doesn't look right, and so everyone understands. I really appreciate that, and look forward to hopefully getting in the new data system and get reliable data. So I hope you don't get too frustrated. But this new system hopefully will give us great data once we figure it out. So thank you.
I would like to say that Steve McGuire and Danielle Race and Gina have been absolutely essential to being able to get these things done. And I don't know that we could have done it without them. So I appreciate those three very much.
Thanks, Melissa. Appreciate that. Does anyone have any questions regarding the data? Okay. This is Lorianne Molina Level. Was there a question? Robin.
Yeah, sorry. I just wanted to understand a little bit better. I know that there is not reliable data available at this point, but is this something that the program should actually let the families know that if there is delays, that again, I don't know how we can, make sure that families are getting services if we can't identify if there's any concerns. Do you understand what I'm saying by that? Or it's like just a little concerned. Do we need to remind families that if they're not receiving the services, that again, they have their rights and they can exercise those?
Thank you, Robin. I agree with you, and I'm going to turn it to Lorianne to answer that.
Yes, thank you, Melissa, and thank you, Robin, for that question. And I can share with you the efforts underway with those same concerns that we have in our office, and which the programs do as well. And then, but I also do see Sarah's hand up as well. So maybe we should see what Sarah's, if you have a question or comment, and then I can come back to Robin's, the response for Robin. Sarah?
Thank you. And thank you for that question, Robin. So I would say the information in needs is reliable and people have been using it. We went live October 20th. Everyone started billing December 1st. The reporting requirements is what is tricky. I know that internally state programs are sharing their services waiting list to Part C, and I know we've shared that with the council before. I don't know if community providers are sharing that with Part C. I know Part C has asked that information be shared so that we could get information internally because there's some tracking. On the state side, there's a lot of pre-made CAN reports that needs designed for OSEP reporting. We're having a lot of trouble with the ad hoc reports and trying to pull information using, I don't have all the IT lingo of the back information data that we can pull stuff from. So that's where a lot of information gets a little bit jumbled. But I did want to reiterate that people are putting in we just don't have we're trying to establish more cleanup processes, and getting that in, but the data, I think we have the mechanisms, we just need to figure out how to get it.
Thank you, Sarah. This is Lorianne Molina Level for the record. And I wanted to add to what Sarah had shared about these processes we're learning and trying to cultivate and evolve along with our vendor, Yahasoft, in requesting fixes of them to perform, and as they go through issues on their side to complete, error corrections or anything like that. So that continues to be a work in progress, so much that we foresee in requiring our project manager for several more months. And so we will continue to provide updates and hope to have some good news for you every quarter that we are making progress. And that is our hope and our goal. With regards to families being informed about services that could be waiting for them, depending on the particular service, yes, that is a requirement in IDEA that all families are notified about that. So the IDEA that was reauthorized in 2004 has not changed. By and large, all of those procedures and regulations remain the same. We went through those kinds of concerns during the pandemic, and required that programs inform families and make sure that they understand and are informed as they give their consent, and as they have discussions about compensatory services that must be made up for whatever reason, whether that's illness or critical staff shortages. And again, reasons on either the family or the provider side. Now, the dispute resolution process does show that families, at least for those cases which you saw on the screen, were informed and felt comfortable and safe to exercise their voice, and to move their concerns forward to formal complaints filed with our office, and that required an investigation. We do require that programs that undergo an investigation and then are later issued any enforcements or corrective action, or a corrective action plan, or CAP for short, that they must have that communication ongoing with families. So we have seen for the programs that have been listed in that complaint investigation, those corrective action pieces being completed, such as the program drafting and utilizing a letter that goes out to all families who may be affected for specific services that are waiting in this current time period. That would be vision services that are available, but yet there may be a delay in obtaining them. So what we have been advised by OSIP and as IDEA advises, whenever a family cannot receive a service for whatever reason, they must be informed with prior written notice. And so their procedural safeguards must be upheld. These kinds of topics are current and ongoing discussions that we have with ADSD, NEIS, and all community programs during our TA calls, which occur monthly to bi-monthly, depending on the season, and also which occur with managers and supervisors and administrators in smaller meetings, or as I had mentioned, in those TA calls. So we are continuing to monitor those programs with the corrective action, and we do see the benefits of that as these new procedures are developed and staff are being trained on those topics. It's our understanding that these kind of discussions to have with families may be uncomfortable and unfamiliar, especially for new staff. But as we see the corrective actions occurring across some regions, and then as we continue to re-emphasize those during our TA calls, it is our hope that programs will all be understanding these topics. And then our PD Center is exploring how we can perform an action series for our professionals in understanding these these very important topics, which they must be proactive on, and then prevent noncompliance and any disconnect for continuity of services. So we plan to have this action series planned and rolled out throughout this year. And we hope to have updates on that as well. So I know that it's a very long answer because it is a very, multi-step and multi-tiered process of getting that communication out to families. Does that answer your question, Robin? And would you like any other information?
Well, again, this is Robin Kincaid for the record. I think the concern is it's very difficult to make progress if you don't have this kind of data collected, and if your system can't do it, you don't have a backup way of collecting this data. It's hard to tell whether or not the entire state is how it's being affected by, for example, staff shortages. I mean, there's just a lot more. Obviously, we want those families and those children to receive the services. That's like the very most important piece of it. But often this data tells us where we have other challenges. And so not having any way of collecting it or validating it, because really nobody believes that 71% or whatever the number was. I don't think there's any way that we would agree that that's, a valid representation of the service delays or whatever. But I guess we're just trying to figure out, we don't want to wake up 6 months from now and then all of a sudden now we have data and oh my goodness, this is really what the data is. So I just get a little concerned that there really isn't any kind of a tracking mechanism, even a reporting by programs, because they must know when they have to do a prior written notice or send out those types of letters. So I think the data must be somehow at the lower level. We can't seem to just get it on a statewide level. I don't know if that makes any sense, but I still have concerns that I feel like we're kind of like operating without the vision that we need. And so just want to make that comment. I don't expect you to respond to that, but I just have concerns that we are not being able to figure out if we're on the right course. I mean, the goal is to have no delays at all. I'm sure we all have that goal, but we're not going to know if we're even getting the right direction, until we are able to see maybe, some data. And for a system that has been set up since October, and we are in April, it seems like the kink should slightly be working out to a certain extent to where we can really figure out. I mean, the Part C has had a long history of waiting lists and delays, and it's certainly gotten a lot better. We just get a little nervous that we might go back the wrong direction. So anyway, those are my comments. Thank you.
And I regret stopping this conversation, but I know that we're going to lose quorum in about a minute. So I'm going to, put the delayed services issue as an agenda item for discussion for our next meeting. I also think we will table the rest of the Part C staff updates that we didn't get to today. I will say the determination letter we have and is publicly available, correct, Lorianne? So we can at least share that letter. So I will work with Lorianne if there's anything that we need to do before we meet again on that. And the family outcome survey will also correct. But I want to, before Brittany leaves, we'll table those items to the next meeting. And then I'm going to open it up for public comment to our 9th item before we wrap up. Does anyone have any additional public comment? Great. Thank you for adding that information about the annual outcome survey.
I wanted to share some updates in the chat for some of the items that we didn't get to today. These aren't full updates, but just a little bit of information, and we will circle back to those during the next call. I also would like to send out a survey for the retreat and October meeting so that we can pin down the best possible date coming for those meetings.
Yeah, so we'll send out a doodle poll to find some dates. We are looking for a longer retreat style meeting for our fall meeting to get into some of these things. Also, some of the things that we're talking about may work really well with some of our subcommittees. So happy to follow up with you on that. And if there's additional topics that you want to include in future meetings, you're welcome to email Mary or myself. We'll obviously take those in and schedule those. I want to thank everyone who volunteered for subcommittees. We will follow up with you on that as well. We also may put out some information about the upcoming OSEP Leadership and Project Directors meeting and the DEC conference that is happening as Lorianne said, in New Orleans, which I'm gonna be honest, New Orleans is very hard to get to from Las Vegas. Just so you know, flights are challenging, but we'll put out some opportunities for you in that. But with that, I do need a motion to adjourn the meeting since we tabled items. Thank you for those sticking on for quorum, Brittany. I really appreciate it. Anyone entertain a motion to adjourn the meeting?
I'll move to adjourn. It's Dave Cassidy.
Thank you, David. Second?
I'll second the motion. This is Robin Kincaid.
Thank you, Robin. Any discussion? Great. Thank you. Oh, I need to vote on it. Sorry, I'm going to forget. Anyone opposed to the motion to adjourn the meeting? Anyone abstaining? Motion carries. We'll adjourn the meeting. Thank you very much. Just as we lose quorum. Perfect. Have a wonderful rest of your month, and we'll be in touch really soon. Mary and I'll be in touch to keep some of the activities that we talked about today moving forward. So thank you all. Have a wonderful rest of your day.
Thanks, Jenna.
Thank you.
It's still recording. Let me know. Mary, we'll just
Oh,
schedule a time to touch base.
I'm going to stop recording, but it's not going to get us